Hi, welcome to another episode of In the Studio, produced by Davis Media Access. I'm Emily Merten, your host, and today we will be talking with two special guests from the Mercer Clinic in Sacramento, the veterinary clinic for pets of the homeless. Why don't you guys start by introducing yourselves and tell me a little bit about what you do at the Mercer Veterinary Clinic and what it's about.
Great. So I am the head coordinator, one of four for the clinic, and I am a veterinary student at UC Davis, a second-year student. Mercer Clinic is run by the second-year students of the UC Davis School of Veterinary Medicine. And as a head coordinator, my role is kind of oversight of the entire runnings of the clinic. So I work with our veterinarian volunteers to create protocols for our clinic. I work with overrunning our other officers to make sure that running of the clinic on the day of goes well as preparations for the clinic between the clinics.
All right, and you?
And I'm Caroline. I'm a pharmacy coordinator. I'm also a second-year veterinary student at UC Davis. In the pharmacy, I work to coordinate donations that come in, donations of food or medications, or even like collars or pet carriers or things like that. We keep as stocked a pharmacy as we can to be able to distribute and care for whatever cases we see that day. And then I work with the rest of the clinic to make sure that everything is kept in order and stocked.
Wow, lots of work. Yeah. So what kind of services do you guys do? Like, you treat the animals. Why don't you elaborate on that?
Sure. So our clinic is a monthly clinic, so it's on the second Saturday of the month in Sacramento. And basically our mission is to focus on preventative medicine as well as disease control and welfare. So our big goal is to get all of the animals that are owned by the homeless community in Sacramento on flea and heartworm prevention, vaccinated so that they're not spreading rabies or any other diseases that are concerns to humans too in the population. And we also do spays and neuters, try and keep the animal population down. And we can also do things like small procedures, removing masses that animals may have, diagnosing other diseases. Unfortunately, they still get things like cancer or tick-borne diseases or any other diseases that other animals get. So we try and keep them healthy and happy as much as we can.
Oh, that's great. So it's all undergrad students in the program, or do you guys have vet volunteers, or how does that work? Who works there?
Yeah.
Yeah, so we do have an undergrad pre-vet population that comes and helps, and the clinic is mainly run though by veterinary students in the actual veterinary program. We see all the cases, interview all the clients, and take histories and do physical exams, and then we'll have a pre-vet student usually with us to help us do the physical, help us with restraint, or to write down any notes we have. And then we have veterinarians from the community who volunteer their time to come out and see clients with us, to help walk us through physical exams if we need it, to talk with us and help come to the correct diagnosis, or do any tests that are needed, and then to prescribe any medications or further diagnostics that we may need.
Oh, wow. Yeah. So what kind of, I'm sorry, what do you do? How are you supported? Like, how do you raise funds for that? Is it nonprofit?
So our clinic is a 501c3 registered nonprofit. We don't charge anything for our clients, being that they're homeless. We do verifications to make sure they're homeless before we accept clients. But in terms of funding, most of our funds come from grants, either from national organizations such as the ASPCA. We get grants from the school sometimes. We also get private donations from the public, private donations from businesses. And then we do selling at the Davis Farmers Market. We sell dog toys there to kind of help, offset costs of medication. So we're all funded either from grants, from businesses, government, or from the local Davis and Sacramento community.
Wow. So there are probably a lot of homeless people who do have pets as company. How do you end up coming in contact with them? Do they come to you, or how do you put it out there, put the word out there?
So we're connected with a local shelter called Loaves and Fishes, and they kind of spread the word for us. We hold the clinic every second Tuesday of the month, so it's kind of known throughout the community that we will be there every clinic, and then if there are any questions, they can direct them to Loaves and Fishes or visit our website at mercerclinic.org.
All right, do we want to show that website? Yeah, so that website, you also have a Facebook page, right?
Yes, we do.
Does that help spread the word a little bit?
Yeah, it spreads the word, not just throughout the homeless community as well as throughout other communities to help get donations and just make people aware.
So how do you think this hands-on experience helps students who are looking to be veterinarians in the future?
I think the nice thing about Mercer Clinic is it involves the undergraduates, veterinary students, and then local vets. So the benefit for undergrads is an opportunity to get hands-on experience in veterinary medicine, which can be very competitive in Davis because it's a large population of pre-vet students here. I went here as an undergraduate as well, and it was a wonderful experience for me to do it, just to really get my hands in there and see what it's like working with clients and working with the patients. And then as veterinary students, the opportunity for us to apply what we're learning in class to a real clinic setting is really helpful. And then for vet volunteers, they're so generous in their time, but a lot of them really enjoy working for us and seeing the clients. So I think overall for everyone involved, it ends up being a good opportunity to learn and a good opportunity to give back.
That's so great to hear. A lot of the people are really passionate about it.
Yeah,
that's great. Sure. So what have you taken from your work? Like, what have you learned from it? And what are some difficulties that you have overcome in the past?
So I've gotten to practice communication with clients, which is a huge thing that it's hard to simulate in a classroom to do. I've also seen cases and been able to back up my education from the classroom in actual cases, getting to diagnose something that we just talked about in the classroom, like ear mites or heartworm or something like that. And then also getting to do treatments, and that's, again, one of the difficult things is there are treatments that we'd like to do or medications that we'd like to prescribe, but since we do run on donations and what limited funds we have, we have to sometimes change the diagnosis, or not the diagnosis, change the medications or treatments that we'd like to do to fit what we have and do the best we can with what we have.
So how long has this been going on? How long has the Mercer Veterinary Clinic been around?
So the clinic has been around for over 20 years now. It was founded in 1991, so by a vet school class a long time ago. And we used to be located in a warehouse right next to Loaves and Fishes, and we have upgraded to having like a real clinic space now, so it's very exciting.
Wow.
And it's definitely been something that's kind of been in that community for a long time. So we have some clients and pets that have been with us for a really long time.
That's so great. So you get to know clients personally too.
Yes. Yeah.
How do you think this benefits the community, like your help?
Yeah, well, with all the preventative medications that we're able to do with the flea and tick medications, the heartworm preventatives, we actually did a heartworm run last year where we tested a lot of clients and a lot of pets and actually came up with really good results of having no heartworm throughout the population. So that's been really huge for us. Also with the spays and neuters, just trying to keep the pet population down and keeping owners out there aware of the possibility of that.
So yeah, so how can the public get involved since you do so much?
Yeah, through donations are always appreciated. We take donations of anything from monetary donations through our website, as well as medication donations. Sometimes if you have a pet that's on a medication, then they don't need it anymore, you can donate it back to your clinic and they can get a hold of us or directly to us if you can visit our website and get a hold of us. And then also things such as medicated food that's hasn't been opened, or even carriers, donations such as sweaters or collars, leashes. We use everything we can. And then in December we do a gift box run where every client who comes in, every pet gets a gift box which includes treats and sweaters and leashes and just things to help them throughout the year.
That's so nice. Those good ways to fundraise, and knowing that we can donate our old things. I know a lot of people that's what we need. So we have some pictures up here on the monitor. Why don't you explain what's going on in these?
Take that.
So this one is from our December clinic, and this is the gift boxes that Caroline was talking about. So we have a veterinary student volunteer and an undergrad student volunteer there giving out our holiday baskets to a couple of homeless clients. So they contain things like Caroline was saying, food, treats, collars, and toys. So that kind of helps lift up their spirits during the holiday times.
Nice. Next slide.
So these are some of the volunteer, vet student volunteers we have. These are our volunteer coordinators, and they go through all of the cases that we have that day and all of the charts for pets, and coordinate who gets to be seen and when, and put that in order, and then make sure that we have filled out charts properly and given all the vaccines and medications that we need to.
So this one is just an example of kind of veterinary student volunteers and what they do. So we grab our chart for the day that our volunteer coordinators have prepared for us. And typically before we do anything, we just go through their records and see kind of what they're here for, what their history is, and what they're going to need. And then the students go out, talk to the owners, get a little history, bring the pet in, and we start our whole physical exam process.
And this is an example of a vet student doing a physical exam on a pet. She's listening to heart or lungs here, just getting an overall view of the pet and seeing if we need to do further diagnostics, or if this is one of our pets in for just a fast check, just to get an overall physical exam, make sure she's still doing healthy, and get her those preventative medications we have.
Wow, it looks like a really well-run program. You guys look like you know what you're doing.
It's been going on for a long time now, so we've had a lot of help from other years.
Yeah, for sure. This is a photo of our pharmacy. We have all the medications from donations. Occasionally we have to buy something that we use a lot of. Here's an example of some students working with a doctor. It's one of our veterinary doctor volunteers. From a prescription that he's decided is needed for a pet. The medications are organized based on what class they are and what they're needed for. So we help the students, and it's a great way to learn medications and how to use them and dosages and things.
That seems very helpful for both our community and the veterinarian community.
Yes, definitely.
It's a learning experience. So what are common illnesses or something common that you get typically from homeless pets or pets of the homeless?
We see a lot of ear problems. Either they have yeast infections or mite infections, which are kind of common throughout household pets as well, but they're just exposed to a little more throughout that. We see a lot of things that need antibiotics if they had a puncture wound or something like that, or eye medications if they got something in their eye.
Mm-hmm.
Yeah.
And how's the treatment going? Like, have you guys been seeing a lot of improvement in animals that you've visited often, or has show up been more, you know?
So it's nice that we have a few clients who are very regular, and it's great to check in on their pets month to month. So they'll come in with a puncture wound, like she's saying is pretty common just from living outdoors. They either get injured or attacked by something, and we can, right away get them on some sort of antibiotics to try and help. And then we check in on them next month, see if we need to do more medications. The nice thing is that we have a lot of clinics that we work in between our clinics. So since we're only once a month, you can imagine it could be difficult to follow up on some more complicated cases. So luckily we work with places like Banfield, or there's a hospital called Mercy Pet Hospital in Sacramento, or even our own VMTH, the teaching hospital at Davis. They see kind of cases for us in between clinics. And so that's nice, so that we can say, hey, do we need to refill medications for this? And so it's nice to kind of be able to follow up on cases. And we do notice that, people who are good and come back month to month, we see less cases of, really bad infections, or they stay healthier longer if they're more consistent.
That's so great that the community is coming together, and you guys really care about the animals. So do you see mostly dogs and cats? Have you gotten any weird animals?
I've only seen dogs and cats. I'm not sure. What about you, Rachel?
Actually, I've been there for 6 years now, and I've yet to see anything else that would be really exciting. I think that dogs and cats are probably the staple for the homeless community. I think other pets would probably be difficult to care for. So yeah, we're definitely a dog and cat clinic. Some of the cats are more feral than others, but they're all still cats.
Yeah, how do you deal with that when you get a cat that's just kind of scary?
Yeah, it can be difficult. I mean, for us, our #1 priority is the safety of our volunteers. So, you know, there have been instances in the past where there's either been dogs or cats that are too aggressive to handle, and we offer the owner an opportunity to either muzzle their dog so we can work with them or do something. We do have sedatives that we can use to like sedate animals so that we can do our procedures, especially when they're a little fearful. But it can be difficult with some of the cats, and so we do as best as we can while keeping everyone safe.
It's a realistic experience.
It's true.
Later on. Well, we're going to be wrapping up pretty soon, so I just wanted to know if you guys want to say anything about the clinic, if you want to put word out there, or any last words around there.
Yeah, so I've been working with the Mercer Clinic for a long time now, so I'm really passionate about it. I've met a ton of people in the Davis community who know about it and are really passionate about it. Our clients are very passionate about it. They're really grateful. So any way that the Davis community wants to get involved, we love hearing from the community of things that the ideas they have or things they want to do, fundraisers that they would want to do with us. Like Caroline was saying, people can go to our website at mercerclinic.org to kind of check us out, look at our photos. We have a Facebook page, Mercer Veterinary Clinic for the Homeless on Facebook. So even if people just want to check out our photos and feel like they get to follow something going on in the community. Yeah, we have a ton of cute animals. As you can tell from some of our photos, we have some really cute pets that come in to see us. And I think it's just a great way of showing how amazing the Davis community is at getting involved. It's a huge project for, you know, utilizing vets, undergrads, and vet students. So I think it's a great example of how the Davis community can come together and really do something bigger.
That's great. And like seeing all the animals and stuff, I think a lot of people, you know, homeless people having pets is kind of a controversial thing, and the fact that you guys get to help the animals, and it must really help the homeless people too, you know, knowing that their animal is safe and cared for. That's wonderful.
Yes, definitely. And the love that these people have for their pets is really touching. They come in and they're really dedicated to the care for the pets and the follow-up and coming back every month and even having to wait in the cold months and being outside and everything. They really show true dedication. It's really touching.
It must change your views a little bit on it. I know, like, listening to this makes me want to like the Facebook page and get involved. So thank you so much for being here today and spreading the word, and thank you so much for your work and the work for the community. So that's about it for our show today. Thank you for joining. If you want to see more videos, you can log on to dctv.davismedia.org, or you can find us on YouTube or on cable channel 15. I am your host, Emily Merten. Thank you for joining me, and I'll see you next time.